Hello, we are Melissa, Daniela, Meribeth, Antonio, and Noelia, and we are going to be talking a little bit about aphasia. When we talk about language, we are not referring just to the words that come out of our mouth in order to be able to speak. Language involves a whole process on the brain that allows us to communicate with others. However, there are some things that might affect this process and make it difficult or even impossibilitate the communication among people. In this case, we are going to be talking and explaining a little bit about one of the disorders that is aphasia. So with that said, I'm going to start by commenting what is aphasia. Aphasia is a language disorder caused by damage in a specific area of the brain in charge to control the language expression and comprehension. It causes that a person ends up being unable to communicate effectively with others. There are many types of aphasia, which are classified depending on the area of the language dominant side of the brain that is being affected.
Thanks. Now I am going to talk about what causes aphasia. Well, aphasia is caused by damage to the language dominant side of the brain, usually the left side, and might be brought on by stroke, head injury, brain tumor, infection, or dementia. Right now, we are not pretty sure if aphasia affects or well, it causes the complete loss of the language structure, or if it causes difficulties in how language is accessed and used. Could you please scroll down a little? Okay, thank you. About the symptoms, sorry, of aphasia, I will talk kind of briefly because my partners will explain a little more details. So, what are the symptoms of aphasia? The symptoms of aphasia depend on on which type of aphasia a person has. So, for example, those people with broadcast aphasia used to eliminated words like death and an. And it's important to know that sometimes people call this kind of aphasia expressive aphasia because they can understand the speech of others, and also they talk in short but meaningful sentences. Also, it's important to mention that because the damage is in the front of the brain, that is really important for motor movements. So people with this kind of aphasia often have like right side weakness or paralysis, sorry, of the arm and leg. Then those with Wernicke's aphasia, sometimes called a receptive aphasia, might speak in long, confusing sentences for days. It's kind of difficult to understand the speech of others, and they used to create new words or use unnecessary words. And then the other one that for me is like a combination of both, because with global aphasia, the people that have this condition have problems for comprehending or understanding, and also with the speaking. Could you please scroll down? Okay, thank you. How is aphasia diagnosed? Well, confirmation of aphasia might be a set of comprehensive language tests. This test includes student speech, naming, repetition, comprehension, sorry, reading and writing. And also for to make a diagnosis might also include the use of imaging procedures to look up the brain, such as the first one, that is a computed tomography, or CT for its acronym. This is an imaging test tomography that use X-rays in a computer to make detailed images of the body. A CT scan shows details of the bones, muscles, fat, and organs. This is really important because a CT scan are more detailed than general X-ray, so for that is better. Then we have a magnetic resonance imaging or MRI. And this is a diagnostic procedure that uses a combination of large magnets, radio frequencies, and a computer to produce detailed images of the organs of and structures within the body. And finally, we have the positron emission tomography or PET. And this is a computer-based imaging technique that uses radioactive substances to examine body processes.
Well, now I'm going to talk about non-fluent aphasia. First of all, what is it? Well, patients with non-fluent aphasia show a slow speech production, and people with this pattern of aphasia sometimes struggle to get words out, and they speak in very short sentences, and sometimes they omit some words. And it is characterized by relentlessly progressive disruption of language fluency. Sometimes these can lead to muteness. Why is it produced? Well, basically, it is produced from a damage in the brain, and in this case, is specifically in the frontal area of the brain, in the central sulcus. As you can see in the image, the frontal area is in color red or pink. Then we have types of non-fluent aphasia. In this case, we have two types or subtypes. The first one is global aphasia, which basically is when the person is completely mute. They cannot speak at all. And then we have Broca's aphasia, and this is basically a damage, usually, well, as I said before, is a slow speech production in a person. So this is caused basically from a damage that it is usually the result of a stroke, but it can also occur due to brain trauma. And well, as another types of aphasia, the intellectual and cognitive abilities unrelated to speech and language can be fully preserved. And something just as an interesting fact, Broca's aphasia was named after the French scientist Paul Broca, who first associated deficits with this type of aphasia, which are localized in brain damage. And no. Well, some characteristics or symptoms that this type of aphasia, basically, they have difficulty in pronouncing phonemes and omission of certain words. In this case, the functions words, they are better at using the content words. Then we have here some examples. So for example, we say, I want a cat, but a person with aphasia would say, I a cat or I cat. And then we have, I'll take the dog for a walk. A person with aphasia, with non-fluent aphasia would say, walk dog, only those two words. And the third one is, I went to the supermarket. Go supermarket me. They also tend to confuse the pronouns, and they cannot recognize the simple for the past form of a verb, or sometimes the future form of a verb. And now we are going to see a short video just to see how a person with aphasia talk.
Can you tell us your name?
Mike Caputo.
And Mike, when was your stroke?
I was 7 years ago,
Okay.
and
what did you used to do?
well, worked Autodesk, seven sales, and worldwide, and very good. Yeah.
Okay. And who are you looking at over there when you turn your
That's
head?
my wife.
Okay.
That's
And why is
my
she
wife.
helping you to talk?
She's
Well, as we could see in the video, Mike has wasn't able to produce complete sentences, and they sometimes just used as words, separate words, and in this case, content words, and that's all.
Then we have the other type of aphasia that is called fluent aphasia. And this one is the results from damage to parts of the left cortex behind the central sulcus. And it is a unique communication disorder that may cause a person to say phrases that sound fluent but lack meaning. Fluent aphasics they don't have problem producing language, but they have a great deal of difficulty selecting, organizing, and monitoring their language production. So there are different types of fluent aphasia, but the most studied one is the one called Wernicke's aphasia. And this one is caused by damage of the Wernicke's area of the brain. This part of the brain was discovered by the neurologist Carl Wernicke when he was investigating the effects of brain damage in different patients of aphasia. So, so he noticed that some patients were able to speak, but not to understand the language. And they used to they used phrases and words that have no sense, and without being conscious about it. So when he was examining the brain of those patients, Wernicke discovered that they all had lesions on the same part of the brain. That was the left hemisphere. More specifically, the lesions were found near to the temporal lobe. So that region is now known as a Wernicke's area, and it is the one that controls the person's ability to understand the language. So for that reason, when that part of the brain get damaged, it impaired the person's ability to understand the language, basically. Next, please. And well, some characteristics of this kind of aphasia is that, the Wernicke's aphasics are unaware of their deficit, and well, normally their speech is completely normal, or it is very good. For example, they have no long pauses, the intonation, sentence intonation is normal, the function words are used in a proper way, and also the word order is usually correct. The problem is that when they speak, they not often make sense in what they say. And for that reason, they have some difficulty understanding others, and also difficulties by reading and writing. And now we are going to see a short video, so where we can notice how a patient is able to answer the questions, but well, what he say is not related at all with with the information that is being asked. So next slide, please.
Hi, Byron. How are you?
I'm happy. Are you pretty? You look good.
What are you doing today?
We stayed with the water over here at the moment and talked with the people for them over there. They're diving for them at the moment. They'll save him the moment. He'll have water very soon for him. With luck for him.
So we're on a cruise and we're about to
We
get to
will
Juneau.
store it right here and they'll save their hands right there for them.
And what were we just doing with the iPad?
Right at the moment, they don't show a darn thing.
With the iPad that we were doing. Like here?
I'd like my change for me and change hands for me. It would happen. I would talk with Donna sometimes. We're out with them. Other people are working with them. I'm very happy with them.
Good.
This girl was very good. And
And that's it in this part.
Okay, now let's talk about treatment. How can people recover from this brain disorder? I'm going to show you some possible solutions. To start, if the brain damage is mild, a person might recover from this brain disorder without any treatment. The first treatment is speech and language therapy. It aims to improve the person's ability to communicate by restoring as much language as possible. This is a really slow process. Some people recover well from this brain disorder, but just few of them can recover full communication levels. There are exercises to slow the pace of speech and enunciate words. This kind of therapy includes no-touch communication tools. For example, the therapist uses strategies, for example, pointing or signaling, and this is when the disorder is very mild. Then we have low-touch communication tools, and in this case, the therapy will use pen, paper, and images. And then we have high-touch communication tools. And this is when the brain disorder is severe. So the therapy is going to use technological devices to help the other person to communicate, for example, communication apps. Another alternative will be medicines. For example, Momentum and Piracetam, but some research is necessary before recommend them. These kind of drugs might improve blood flow to the brain, and they are going to improve or replace depleted chemicals to the brain. And then we have two other alternatives. The first one is transcranial magnetic stimulation. This one uses magnetic fields. And the second one is transcranial direct current stimulation. This one uses a low current through electrodes in the brain. Well, as a conclusion, I'm going to summarize the main points of the presentation. So let's remember that aphasia is a disorder that affects the ability to communicate. And there are two main types, non-fluent and fluent. The first one affects language production, while the second one affects language comprehension. Aphasia is caused by strokes or head injuries, and the best treatment or solution is going through therapy. And here are the references, and that's all. I hope you learned, and thank you for your attention. Bye.